Happy Friday. This is Ray Pedden from the Center for Care Innovations. Welcome to CCI's Raven e-learning series. The Raven e-learning series has been developed to highlight technology solutions that address priority areas that have been identified by our safety net provider community. This series is designed to be a learning opportunity, and we encourage attendees to engage with the faculty during the session. You can see future topics in the series at raven.careinnovations.org/e-learning. Today's session is focused on texting for better health. Specifically, we will be trying to discuss using texting in conjunction with patient scheduling, using texting to engage and manage a complex patient population between visits, and using texting as an outreach tool for targeted populations. For today's faculty, we have several individuals, and I'd like to introduce them briefly before we get started with the presentations. First of all, we have Julie Edgecombe, the Ambulatory Services Administrator for the Monterey County Health Department. Julie has over 40 years of experience in human services, including criminal justice, secondary education, vocational rehabilitation, and health. She currently has responsibility for 12 primary care and multi-specialty clinics that provide health care to over 63,000 people. Mr. Stephen Gutierrez is the Chief Information Officer at Northeast Valley Health Corporation. Stephen's main focus has been in managing the growth and integration of technology across all sections of the corporation and developing a strategic guideline to follow for future expansion. He has been instrumental in implementing systems such as NextGen, EPM EHR, Dentrix Dental, a CarePoint pharmacy system, Eye-to-Eye Tracks population management system, an automated reporting system, a voice-over-IP enterprise-wide communication system with interactive voice response for 24-hour prescription refills, automated outreach through text and voice communication, and most recently was involved in converting a CarePoint pharmacy system to a QSI pharmacy system. Adriana Velas is the Outpatient Services Manager for Monterey County Health Department. Adriana has 13 years combination experience working as a patient services representative and providing support as Departmental Information System Specialist to Monterey County Health Department Clinic Services Bureau. She is currently an Outpatient Services Manager with responsibility for several outpatient customer service center areas and is currently completing her education and always eager to collaborate with us on innovation in healthcare. I'd like everybody to welcome our distinguished faculty as we move into today's presentation. What we're going to try and do today as a part of our agenda is, first of all, I'm going to take a brief period of time and try and frame the challenge that we face here in the safety net. Secondly, I'd like to move on and turn the podium over to Steve Gutierrez from Northeast Valley Health Corporation to talk a bit more in depth about everything that's going on at Northeast Valley. Then we will turn to Monterey County to get a view into their experience in the texting for better care. Finally, Angela from CCI is going to wrap up with an extraordinary body of work that she's done in developing what we call a texting landscape to give you further information about a variety of folks that are playing in this space called texting that's been around for quite a long time. So today we have three presenters plus the texting landscape. And at this point in time, I'd like to turn to the challenges that we're trying to face here in the safety net. And I've boiled that down to three basic challenges that we hear about all the time. The first one is trying to use texting in conjunction with patient scheduling. And that's to optimize how we deploy our resources in our patient care. Using texting to engage and manage a complex patient population in between visits, because we're intent upon engaging the patient as a partner in care and not just waiting for the next visit. And finally, using texting as an outreach tool for targeted populations depending on the specific needs of our own safety net provider organization. With that in mind, I'd like to turn to Stephen Gutierrez. Welcome. And let him take you through a view of what Northeast Valley is doing in the texting area. Stephen?
Hi, good afternoon, everyone. I think this is not necessarily a new subject, so we're always looking for something new and innovative, or just results that are happening, and so we can implement some best practices. So let me go ahead and show you what we're doing at Northeast Valley, and just really discuss how we got there and some of the results that we're starting to see. Go ahead, next slide. So I want to talk about there's what we're using it for, 4 types of messages that are going out. As Ray said, appointment messaging was one of the first areas that we started out with. Then we've moved into that gaps in care, or as you're saying, managing your complex patients in between visits. What the vendor we're using has another unique thing of what we're calling interactive self-management goals. So we'll talk about those a little bit, engaging your patient there, and then the general notifications going out, just informing them about information, things that are happening at Northeast Valley and plan changes. So we'll talk about those. So on the appointment side, what we originally started out with appointment reminders, which I think a lot of groups did. And after that, what I wanted to put really at the top is we started getting requests when a new appointment is made, we immediately send out a confirmation text message to the patient with the address of the location. That came through a suggestion from our patient advisory group to make sure that they had the right location, because occasionally they would go to the wrong location. They try to remember, we always would send them the reminders with the name of the location, but sometimes they didn't have the address. And so by doing it this way in their texting list, they're going to have that address right at the top. So when they get the reminder, right above it, hopefully, is that address. So that was very popular with our patients. We'll say, so as soon as you make an appointment, you get a confirmation. If you call and reschedule, you get a new appointment reminder message that goes out in a couple of minutes. So everybody's looking for instant gratification. So that's one of the things that we found out was very popular. Our appointment reminders that we send out, we send out 2. We do one 3 days in advance, and then we do another one day in advance. And we're contemplating actually maybe starting a little farther in advance, maybe for appointments that are made longer in advance, because at 3 days in advance, sometimes people have forgotten and already made plans, and then they're going to cancel on you, or they're going to break that appointment. But the key on the next 2 are actually the response back. We really are finding that response back very useful. So when the appointment goes out, we're looking for that response, and for the patient to either confirm they're going to come, or we give them the option to cancel that appointment. So if they're not going to make it, we'd rather know than have them just not show up and leave an empty appointment slot. So the cancellation ended up being one of the silver linings that we didn't think about originally, that we use that a lot now, and to fill appointments and keep our broken appointment reminder rates down. The third item down is something new we're starting to do, and we have used the statistics to identify those patients that are high risk of breaking their appointment. So we've categorized patients now using a 6-month look back of how often they break. What's the percentage they break? So if they break more than 80% of the time, we put them in a high risk category, and then we have a low risk and a middle risk. But right now, if they're in that high risk category, it's the only one we're using, we send them a different response, a different message going out, indicating that we do notice that they break their appointments more. We actually send out 2 text messages. So we send out the one talking about their behavior first, letting them know that that they do. We've noticed that they break more often, and just reminding them to cancel if they aren't going to be able to make it. And then we send out the second one, is our typical standard appointment message with those options, reminding them of their appointment and giving them the options to cancel. So part of the reason we sent them 2 is just we couldn't fit all the message into one text message size. So we decided to go with the 2. And to give you some, ideas of how effective that was, you can see one of the things we do is we track the number of messages we sent out, and we send out about 22,000 text messages a month going in there. So that becomes important to track as you start to make your choice on your vendor and what those costs are going to be. So you got to keep that in mind, and that you'll also have to know if you're getting responses back, those count toward transaction activity that we'll talk about a little bit later. Our response rate right now, and that's really useful to know, is we get about 9% of the people respond. We believe right now that that's related to the way the response is formatted. So our response back is a little more complicated than we like it to be. Since we send out multiple reminders per family, we require them to send back a multiple digit code to help us identify which appointment they're canceling or they're responding to. And we believe that that may cause them not to respond as easily. So we're actually looking at changing that just to give us a response back, a simple one character, that they're confirming or canceling. And then we're going to use that and use with some logic to try to determine which appointment they're talking about. But we get a 9% response rate back now. And then we've tracked our broken appointment rates based on that response. And we know that if a patient responds, their broken appointment rate goes down to 12% versus our typical 20 to 21%. So we see that there's about a 1/3 reduction there. So we want to get more people responding back so we know their status, and we hope that our broken appointment rate will get closer to that 12%. And then you can see at the bottom, we get about 2.3%, and it used to be closer to 4%, of our patients are canceling. And that's good to know. When we cancel, our system currently is integrated with our electronic health record, so those confirmations and cancellations are automatically documented in the EHR. And then that opens up on a cancel, it opens up that appointment to be changed out. For somebody else to take that appointment. So that really helps on our productivity. So that's what we're doing with appointments. I don't know, Ray, if you want to, we're going to take questions at the end, or we finish up our...
Well, it's pretty much up to the folks. I've been watching the chat box to see if questions come in, or if individuals want to unmute themselves in order to ask a question, please feel free. Okay. But we'll keep moving along.
Keep going. Okay.
But hopefully people will ask.
Okay. So that's what we're doing in appointments. So that's our focus there. The second one is what we like to call gaps in care, dealing with your complex patients in between visits. We are sending these out, and they are actually going out not out of our EHR, but out of our population health management system, I2I tracks right now. The reason we do that is because the care message, who we're usually using right now, was integrated with them at the beginning. Makes it they have a nice system of being able to query the group that you want to send out messages to, and it documents, and we think that's a key. It documents that attempt and that information so we can continue to track that, those enrollment or engagement strategies. So we need to consider appointment access availability before outreaching to the patient. So something I think we learned early on, and we now build into our messaging strategy, that you don't want to send out too many appointment gaps in care reminders, because you might get overloaded coming back in and not have the access to make appointments for those patients. And then they get upset because they called in and then you told them it was 3 weeks out, and then they may not respond the next time. So we noticed that was one of our original problems. So make sure that you have that access availability before you send out, and we now focus on maybe one location or a smaller subset of patients before we send those out. Consider patients in multiple categories that are maybe a diabetic and have hypertension and a number of other chronic conditions, may get multiple messages resulting in message fatigue. So if they get 3 or 4 very quickly, they may get tired of that. So keep that in mind as you're sending out these messages. Can you send out one message that has to a patient with 2 or 3 issues on it? That's an option depending on your text messaging carrier. Or you can just categorize the groups individually and do it at different times of the month. And don't forget about your sensitivity, their sensitive service area. So consider that confidentiality flag. Make sure you don't start texting patients that or have indicated they want that information confidential, and it will get to the wrong patient, so that HIPAA violation. So consider that as build that into all of your messaging things as well. You can see that in Q4, for these gaps in care, we sent out 6,639 messages to patients about 3 category areas. So Pap smear reminders, A1C reminders, and Fit Kit for colorectal screening reminders. That's another area we work on. The third one is interactive self-management program. So this one may be a little more unique to our vendor. They have the ability to enroll patients into one of these self-management goals. It's our group works with the patient to get they actually get to select which self-management program they want to be in. And it's typically smoking or nutrition right now. And they'll enroll, and this is a 6-week typically a 6-week program, where they will get, I believe it's 2 messages a week, just asking them how they're doing with their self-management goal this week. And based on their response, it's all interactive with no human intervention. It will look up their message coming back and pick one of the predefined messages, and it coaches them back. And so if they say hey, I had a stressful week and I had to have a cigarette, it will pick up on that and say, well, those weeks happen, and here may be some tips on how to deal with that stress week instead of picking up a cigarette. And many of our patients actually thought it was somebody responding. The messages are so good. So that was we find that very interesting and popular with our patients, even though it may not have the QI results, directly associated with it. So that's just a nice extra thing that was available to us. And now then the last one is, change that slide, is just other campaigns that you'll have. Some of those that we've used are, we like to try to engage our new managed care members that come and send them some kind of welcome message and try to get them to come in for their initial visit, and trying to, I think most of us have plan requirements that we have to get them in about 90 days or so. So we try to contact them with automated procedures first before we make that robust calling with somebody. Other times we've used is when there's a change in the plan or policy, or some kind of health environment change, we blast out messages to a group of patients. So these type of messages do not expect a response back, and we're just trying to inform our patients. You could do these through patient portal and other kind of campaigns as well, but we tried to do it with text messaging. Hours of operation notifications may change. We've talked about using that for campaigns. So these are things we're currently doing. Yes, right.
Before we go to the next one, Jared Christinaut asked a question, whether you can comment on the message information sent out and being sensitive to HIPAA, and how do you ensure HIPAA compliance, and how do you approach the whole HIPAA challenge?
So there's, and I know there's several schools of thought in this that we've attended several webinars and got opinions. I guess I'll start out with, first of all, there's sort of the opt-in, opt-out approach, and you have to determine which way you want to go with there's not one that's acceptable. We have gone with the opt-out approach, starting with text messaging. So if a patient provides us with their cell phone number, we'll immediately send them that appointment reminder message, and they get the option in each message to opt out and stop getting those messages in the future. So in just getting them enrolled, that's how we've approached it. The other items, as far as HIPAA, we believe that the text message is HIPAA compliant, specifically since we've got that message. A little controversial in that if you have one phone number for multiple patients. And the way we address that is our messages try to be very limited on the PHI that's going out there. We do not actually tell them what type of appointment. For instance, that they have an appointment coming in. We've had feedback from patients that they don't always like that. Some of them want to know what type of patient, what type of appointment. But because of those HIPAA guidelines, we decided not to, in case it's a shared phone. type of idea. So that is really the way we've limited just the amount of information we put on there. So even on the gaps in care, we have formatted the message to not necessarily say that they're a diabetic and they need an A1C, but that that more in the lines of you need an A1C every 6 months. If you have not had one yet, please come in and take that test. So it doesn't specifically say that they are a diabetic, but we hope that they'll interpret that way, and that's the way we've approached HIPAA and all. So I hope that answers the question.
I think it does. And
Okay.
a follow-up question to that is, what share of people opt out?
Very small percentage. So we get, I believe it's less than 1% that opt out of our messaging. Our system, actually, a current system at least, allows them to actually opt back in. So when they opt out, they get one more message that says, if you change your mind, you can send the start, so the word start back to us, and we'll automatically turn your messaging back on.
Very good. Thank you.
Okay. And then, some things that we're thinking about going forward, because, we always want to progress with what we're using. So these are ideas that we've talked about. None of them are currently being designed yet. But medication refill reminders has come up as one of those. So because we do have an internal pharmacy system, you've got your EHR, when the prescription was written and the quantity, you could send your patients some kind of message based on where you think they should be running out, and saying, now, don't forget to go refill your medication. You should be out. So we want to try to help patients be more compliant on their medications. Second was, you can see, this was probably the more likely one to come next, is if a provider calls out sick or maybe is going to be on vacation, unexpected vacation, we want to possibly send out a message saying, hey, your provider is unavailable for this visit, and let them know that before, rather than showing up at the clinic and being surprised that the provider isn't there. We have had some patients that will get there and not want to meet with the provider who has been covering there. And it also would help in, just drew a blank on the, make sure that we're seeing the same patient, same provider over and over. So that's something we're considering sending out at the last minute, so patients, definitely don't come and be surprised. The other would be when we even more important would be when we can't get that shift covered. So if a provider calls out sick and we don't have coverage and we're canceling the session, we're talking about sending out a text message to cancel that session and then follow up with a voice call as well. But we want to try to get a message out as soon as possible if they're having to travel, and then try to follow up and get them rescheduled. The last one is an item for productivity. We want to start to look at where we have openings or where people are canceling, based on even the first part where we're automatically getting those cancellations in. And if we have some openings, would it be possible to contact the patient via text and say, hey, we've got an opening for today instead of tomorrow or next week. Would you like to come in and fill in? And we think we're looking at that as a productivity issue, and it would fill in our sessions and hopefully, keep those sessions open and provide better patient care as well. So that's where we're heading with where we've been and where we're going. And I don't know if there's any other questions.
One other question came in from Cheryl Lewis. Do you message adolescents who are receiving reproductive health services?
So the shorter answer is yes, we do. So we don't eliminate a group of patients just because of age or just because of the location or the type of visit they're coming in for. Our staff have contacted them in the past conversations they've had, or what type of communication can we work with you? And if the patient has said, yes, I have my own cell phone, that is the best communication method, and they have not flagged them as being confidential, we will send them a notification.
Okay. From Regina Neal. How long have you been using texting in the ways you describe? How did you start the work? Did you use a PDSA approach or trying to just implement? With what type of texting did you start?
Well, we didn't really use a formal PDSA. We actually started to try to design it ourselves. So we went out and got a small platform where we could do all the logic, and we would just send it out. And you'll see those later on this grid that's provided to you. There are a number of different types of provider solutions. and tried to design it ourselves and send out these messages, and it really crashed and burned. We found out that it was a lot of difficulty to design that message, send it out, look for the response back, try to respond to that response, and create your own sort of texting solution. It may ultimately cost less per transaction, but that design time, we decided we didn't have the internal expertise, so that didn't work out well. So then we went out and talked to another company, and they had a texting solution, and they had programming abilities to make this out, but they didn't have a full-fledged turnkey solution. So we worked with them and brought our ideas out, and we did have a small group task force that came up with the ideas, and we handed out what we were trying to accomplish, and they actually did the programming for us. We ultimately learned how to support it and put in our own messages, and so we do have that platform, and it is a in-house solution, meaning it is on our data center, and we dropped the messages to it. We wrote our own integration to our EHR because it wasn't available from them, and we dropped those off. But going forward, they're no longer supporting that premise-based solution, that in-house solution, and they want to go to a cloud solution. So we just provide them with the information, and they'll send it out. But the cost structure is changing, so that's why we started looking at other solutions and have ultimately selected Care Message to start using, because they've got a turnkey solution already designed and integration right into our EHR.
Okay, we need to move along here, so.
Yes, and then, okay, so yes, and then at the end here, I just want to show you our key, we think our keys to success. We think integration into your EHR is just number one. If you don't have that from your vendor, we eliminated the vendor from contention. The platform must be able to handle the volume in a timely manner. So make sure that they have more than one circuit going out, or else it can take hours to send out messages. That was one of the things we learned early. Platform must have the ability to receive responses. We believe that response back is really important to know what your patients are thinking and adjust your schedule. And as we talked before, ease of response is going to increase your response rate, we believe. Make sure to brand your message. We did early on get messages back from our patients saying, "Who are you?" Because they maybe have lots of different kind of appointments. So make sure you have your name in there somewhere. Capability to run, status delivery reports. So you want to know, are those messages getting through? Is the patient's phone turned off, out of service? Those kind of things you want to know so you can contact them other ways. And then, as we talked before, the ability to allow the patient to opt out if you've gone that way is a very popular in that they have that option to do that, but we get a very low response. Most people are not opting out. And there you go. And then later on, you're going to see some cost structures designs. You're going to get a number of groups that Ray's team has done some research on, I believe, and you'll see those cost structures. But there is three types really are cost per message going out, and you get charged both for sent and received messages. You've got the structure where there's a cost per patient, so you get unlimited messages, but it costs per patient whether you're sending messages to them or not. So if you have inactive patients in your chart, they may be counted and you're charged for, so you have to be careful with that. And then you really have as we talked a little bit about before, that flat rate platform that is very inexpensive per message because it's just a flat rate, but you have to typically you have to develop your own platform and integration. So those are cheaper, but take a lot more expertise to do that. So you'll learn more about that at the end of the presentations. Okay, but thank you.
Thank you, Stephen, very much. I'd like to turn now to Julie Edgecombe and Adriana Velez from Monterey. They are also deeply involved with texting and development of texting and messaging support services for their patient population. So Julie and Adriana, hopefully you're aboard, and I want to turn the gavel over to you.
Okay, this is Julie, and I'm turning the gavel over to Adriana because she's the one who actually did all the work on this and keeps it going. So, Adi.
Hello, everybody. Okay. So we kind of veered onto this adventure here after we attended one of the actual CCI innovation conferences. We had been thinking for a while about a lot of the barriers that we were going through, a lot of the no-show, or high no-show rates mostly, and the amount of appointments that we were scheduling, and we were just getting tons of no-shows, lost opportunities with a lot of the missed appointments. So what we decided to do after we attended the conference was put a group together with support from Julie and our quality improvement team. And the goal was to figure out what new technology our patients needed. So we implemented this group made up of different background skills and knowledge, several staff members, people from IT, some of our staff who were very knowledgeable with our current EHR, which we use Epic. We used a lot of other people from different groups, like we work really, really closely with our privacy officer and a lot of our site specialists, which kind of handle all of the IT and Epic related issues. We began to meet bi-weekly. We started to brainstorm, plan, kind of create some measures of what we were trying to accomplish, and basically just design the project from a technical aspect and an operational perspective. Okay, so as we began to think about implementation, a lot of the things that we were thinking about is, do our patients really want this type of technology? So we decided to survey a good group of patients and realized that the majority, at least 80% of our patients, did have access to smartphones. So it gave us a lot of confidence to kind of move forward with the new technology. We did review and researched several vendors. We ended up going with CareMessage because it met all of our expectations and the goals, and a possible future bi-directional interface, which was kind of like the end goal for us. After we selected our software, we basically kind of learned it ourselves, kind of measured to see if it would do whatever we needed to do. Unfortunately, we did come up with some bumps across the road, which was, it was not possible to integrate at the time. So we had a one-directional HL7 interface. So during that time, we did have to use a lot of our staff, so that was a little bit of a downside to it. We ended up having to use staff from our front desk to manually upload the files into CareMessage and then send them out and then receive the reports of the cancellations and the confirmation. So that took a little bit of staff time, so but that only lasted for a little while. We kind of focused on our future goals, making sure that we worked rapidly to our integration. One of the things that I would definitely suggest for those of you who are looking into texting is to make sure that you have the right amount of staff, the right people on your team as you're moving forward. Consider who will be affected with the changes, and make sure that you get buy-in from your quality improvement team, your providers. A lot of our providers had a lot of questions and actually brought up good points as we went along. So kind of involving everybody with whatever change you're implementing is always helpful, because they may bring up questions that you have not thought about. Once we basically got everyone's buy-in, trained the team the way they were supposed to be trained, we kind of moved forward to our actual go live. We made sure that we created helpful and simple workflows to make sure that everybody knew kind of their role. We ensured that we worked together with our IT group to make sure that the reports that were required were available. We ourselves actually created some internal reports within our QI team to measure no-shows. One of the things we did find out immediately is that our no-show rates did drop from we used to have a steady 20% to above no-show rate, and it, within the first 3 months, it dropped to about 17%, which was exciting for us. The only issues that came across during that time was there was still a lot of questions from our staff, from our patients coming across of how this technology would be used, a lot of the things, how how would they respond to patients if they ask questions. So we came up with a FAQ for both our staff and some of our patients if they were calling in. We also made sure that we provided a lot of the information of this new technology over our website. In our clinics, we currently have smart boards, and we add that information for the patients to kind of see while they're waiting in the lobby. Very much like Stephen, started to think in advance about what we were going to need for the near future, like our goals were to possibly send out outreach reminders, and how can we use this to better serve our patients.
Adriana,
yes.
We have a question from Carmen Ibarra. She's asking if you would please elaborate on what you believe is the right type of staff to be involved in this kind of a project.
Absolutely. So we began with a small group of, I believe it was 5 of us, which were Julie, myself, and site specialists, which they are in charge of training and supporting our current EHR. And then somebody from our call center. Yeah. So we quickly realized that we needed to get more staff involved, because they were the ones that would eventually be running the reports, or they would be uploading the files. So we decided to add staff from our call center and also tie in some of the supervisors in the clinic, because they would work with their staff previously, anything that had to do with confirmation. So kind of get their ideas and make sure that we kind of dotted our I's and crossed our T's to make sure we weren't missing anything.
So what happens, and I always am the one who underestimates this, I think we have this great idea, it's texting, everybody's going to love it. But what ends up happening is people start worrying about their specific workflows, the details of how it is really going to work, how's it going to affect their job, and anxiety builds. So we found that the sooner in the process where we're talking to the physicians, the call center, the front desk people, the medical assistants, the IT people, the privacy people, anybody we could think of, that helped, because with any change, anxiety goes up, and questions I don't even think about suddenly are areas of stress for staff.
Great.
So a lot of the questions that came up were very similar to the things that Stephen had brought up. For example, how would we keep HIPAA compliant? How would we ensure that the messages were going out to the patients who were possibly receiving, birth control and things like that? So we had to find ways to make sure that we were able to flag our charts. So all these ideas and questions came from a lot of our staff. And I think that integrating everybody was really, really successful for us to identify all these issues and questions and then address them. After we actually did have our confirmation, our one-directional go live, we did notice that our front desk work decreased. They weren't having to pick up the phone on a daily basis and call, numerous amounts of patients were, for example, I'll give you my clinic. We have 9 doctors and they see approximately, 25 to 30 visits each provider. So they were spending a lot of time basically on the phone. So once we started texting our patients with their confirmation, it allowed our front desk to have a little bit more face-to-face interactions and improving patient satisfaction just in general. They were able to focus more on registration, prepping the charts, and ensuring that all of billing inquiries were all completed, and provide just better customer service. We were able to set standard confirmation language in the same manner across all of our departments, which was nice, because previous to that, we all kind of sent out a little bit of a different message. We still continue to measure no-show rates and still sometimes confirm via phone if we don't get that confirmation from the patient. We do send out our messages 2 days before, and then if no response is received, we do send out one voicemail reminder the day before.
A quick question from Cheryl Lewis. You stated that 80% of your patients had iPhones based upon chatting with your patients. Did that 80%?
Survey.
We did a survey.
Or survey? Did that 80% all opt in for messaging, and did the number change over time? What happened, with regard to that 80%?
Actually, the percentage has grown. Yeah, the majority of our patients, we're very fortunate here in Monterey County. Our medical,
Our managed care
medical also provides cell phones to some of our patients, and usually they're smartphones. So as this technology started to grow, we kind of worked with our managed medical care to let them know that this is what we were trying. And so they're encouraging our patients to get these cell phones. They actually would come to the clinic and have the patients sign up. So it has definitely grown. And we have a very, very small percentage of patients opting out. It's like less than 2%.
Well, thank you.
Okay. Since our original go live, we've been working really hard with our vendor, which is CareMessage, and our EPIC, our electronic medical record. And we've actually successfully now implemented a bi-directional interface for text confirmations. So now anytime that we text anything out, the responses come in directly into our EHR. So just as Steven mentioned, those canceled appointments, we use them so wisely now. We have the availability to fill in those gaps and make sure that we get somebody scheduled, because we do get the cancellation usually 2 days before or a day in advance, which has been really successful in helping us ensure we get patients in. We have a high percentage of walk-in patients, so that's kind of helped us out and even it out. We are also in the last phase of testing our bi-directional outreach and self-management programs with our EHR. We have a tentative go-live date of possibly the beginning of March 2019. And that will include self-management for diabetes and hypertension, where we can actually do the setup within our EHR and actually track inside of our EHR. We're actually now able to send out outreach messages, very similar to what Steven's clinic is doing, the flu vaccine clinics, the health maintenance reminders, best practices, just general messages of, flu season's coming, and sure to come into your clinic and get your vaccines, such things like those. We did make sure that we created an FAQ. That was really, really important for our staff to have just handy. It was just really helpful. So I just kind of want to stress that.
Yes, the frequently asked questions helps. We're planning to do a annual schedule for the text, how we're going to do text reminders, whether it's by clinic, obviously the pediatric clinic will have a different annual schedule than the internal medicine clinic or whatever. But we want this to become just a regular annual schedule, so we're not having to constantly think. And then as our quality improvement team comes up with quality improvement projects, they may want to target a specific subgroup of patients or social determinants or chronic diseases. And our medical director is a very strong believer in PDSA, fast PDSA. So it'll be done through that process.
Great. Thank you, Julie and Adriana.
You're welcome.
Now I'd like to turn to Angela Liu. Angela has developed a texting landscape. And as a part of the heavy lift of doing an enormous amount of research into this particular area, I think she has become the world's leading expert on texting platform. So as an orientation to that resource to our audience, I'd like to turn this over to Angela.
Do you mind? I'm sorry to interrupt. Do you mind if I ask a question?
Please.
Hi, my name is George. We're here from Serve the People Clinic in Orange County in Southern California. Adrian, I just have a quick question, and thanks for all your information. I was wondering, this might be a far-fetched question. Are you at any rate assessing the impact that this is having on health outcomes at all, or any kind of health-related outcomes?
We will be in the next couple of months. Our go live with the outreach and the self-care management is going to kind of launch real soon, and then we're going to be looking at targeting such things as diabetes and A1Cs, and then trying to measure some of these items. But our medical director has kind of, focused us on that direction next. So not yet.
It's definitely pending.
Yeah,
Sure. Great. Sounds good. Thank you so much.
absolutely.
Angela.
Yeah, thank you for the asking the question, George. And hi, everyone. I'm Angela Liu, Program Coordinator at CCI. And first, I just want to thank Stephen and Julie and Adriana for giving us that great background and all the nitty-gritty details that we all are looking for when starting to understand and embark on a project like this. So as oh, thank you, Ray, for changing the slide. So as Ray mentioned, we have been working on this texting landscape for those of you who, haven't quite selected a vendor yet, and you're just starting to get into exploring what technology, what solutions are out there, and selecting somebody to partner and work with. So in the course of this research, we looked at about almost 20 different solutions, and with the guardrails of looking for a more solutions that were more turnkey, as Stephen and Adriana mentioned. So that means having, some sort of campaign logic pre-developed, reporting, basic reporting, EHR features, EHR integration features built in. So you can see and access the link here on the slide. So that's careinnovation.org/resources/texting-landscape. And I'm not going to go into the super detailed version of it, but basically what we did on the landscape is out of that field of 18 to 20 vendors we looked at, we selected 3 to feature as particularly suited to our criteria, which is pretty turnkey, has worked with the safety net, kind of understands that patient population and that organizational, the challenges and resource constraints of kind of the FQHC public health system world. So you can take a look at that link for those that were featured, as well as just all the details we gathered and all the intel we gathered on the other vendors. And now I'm ready for my 4 takeaways, which I'll share with you guys. So let's see. So these are just 4 kind of takeaways, observations I came across while putting together this landscape. And so if you go to the next slide, Ray. So the first finding was building on so CCI released back in 2015 a Texting for Better Care toolkit, and there was a program involving some of the players we've heard from today, and it was all around texting implementation, and there was this great toolkit that came out of it with challenges, with suggestions around how to approach consent and the EHR integration. So just kind of your A to Z guide for implementing these solutions. So as I was looking at that and then starting to look at the field and talking to our FQHC and safety net partners, there's just this increased sophistication from all players. So from the provider organizations asking, like knowing what to ask for, like having the language to, say like, oh, I need bilateral texting because I want my patients to be able to respond to me, and I know what I need now. And the solution partners, the solution vendors, kind of developing more, evidence-based campaigns around the kind of more chronic care outreach campaigns. So there's just this increased sophistication. So it's constantly growing, and the technology is just and content, and it's becoming very sophisticated for all use cases. Next slide, Ray. Along those lines, we really started this texting landscape as a texting landscape. So we were really looking at, what SMS messaging platforms are are out there, and just having this very narrow focus. And what we found was that many of the solutions are now kind of moving towards this idea of a all-around patient communications wraparound solution. So you have your phone, you have your email, you have your texting, all kind of wrapped up in one package. And it's kind of hard to find, apart from the flat fee platforms that you develop on top of just a solid standalone texting solution. So you'll see more and more that the players in this space, the vendors in this space, are working to kind of get a slice of everything around patient communications. And next slide. So in the process of this, I worked with quite a few vendors, quite a few contacts on the vendor side, and they're all actually pretty lovely to work with. But just a reminder to know who you're, kind of put yourself in your vendor's shoes and understand what their target audience is, and who they're really building for, who they're really trying to understand. Because especially working in the safety net, there are very different needs and use cases than some of the more the rest of the healthcare system, we'll say. Also, it helps to know, as payers start using their own text messaging systems and trying to understand, your payer mix, and trying to align with the kind of platforms they're using for integration purposes, and just really holding a bigger picture as you search. And another last takeaway to leave you guys with, putting yourself in your patient's shoes. So I was thinking of this as Matt from Contra Costa. We were on a call a couple weeks back, and he mentioned that, texting is effective right now for our patients because it hasn't, kind of been ruined by overuse by everybody, like it hasn't become email where you're just constantly bombarded with all these messages. So just being really thoughtful about where else your patients may be getting text messages from, whether it's, there's this rise of texting campaigns for politics, and just it runs the whole gamut, right? So so again, another reminder to be thinking about who else is out there, who you can align with, and making sure that the texts are meaningful and not just noise. And I think that is all I have. I see some questions. So let's see. Sarah had mentioned that. Could you give us a sense of how much these texting platforms cost per patient on average? So in the process of this, we got some quotes around the cost, but it's hard to say. We didn't want to publish those because they're not always accurate, and we found that whatever they're saying to us right now could be wildly different than whatever comes out of a contract negotiation. So we did publish the pricing structures as Stephen had mentioned. So is it a flat cost? Is it a per patient per month, provider per month, per year? So that information is all available in the landscape. And then one more question that I could address. So from Sam Garena, are your outgoing messages bilingual? And if so, can the system customize by patient preferred language? I'm going to pass that over to Stephen and Adriana.
So this is Adriana for Monterey County. We do have them go out depending on what we have assigned as language in our EHR.
Yeah, this is Stephen, Northeast Valley. Same thing. The system picks up the preferred language of the patient out of your EHR and sends out an appropriate language message.
Great, thank you. And then there's one more question I'm not sure if you guys can address. Is anybody in the group using texting as well as the patient portal within the EHR itself? If so, how is each platform being utilized?
Monterey County is currently not using the portal, but we are looking to do so in the near future.
We use our portal, just not for texting.
Yeah.
We've increased our use of the patient portal considerably in the last year, but I don't think we've linked texting to it.
Not yet.
I was going to say, this is Stephen at Northeast Valley. Very similar answer. We do have the portal up and running. We do not text this message through the portal right now, partly because the number of patients that are enrolled in the portal is much less. We only have about 10%, and you get a larger group of your patients via texting right now. But we are trying to move exactly to that kind of platform and actually send out in our text maybe a link to the patient portal to get them to start using it more.
Great. And there was one more question about including Asian languages in the outgoing messages. Just a quick note on that in regards to the landscape there. We did survey everyone who participated in that landscape around the primary languages that their campaigns and messages are available in. So you can, if you're looking for a vendor, you can sort by that. I'll let Stephen and Adriana comment on kind of your patient populations, including Asian languages.
For Monterey County, currently we only use Spanish and English because that's what is available through our vendor, but they are doing, as far as I know, some research on possibly adding additional languages because we do have a lot of other languages here in our area, especially in the peninsula.
This is Stephen at Northeast Valley. Since our patient population, 70% speak Spanish, that we, again, as well, only use English and Spanish. So if it isn't Spanish, we actually send it out in English. I will tell you that I attended a conference where somebody presented from the East Coast who had a number of Asian dialects and a number of European type dialects. They actually said that they did not see much difference. They would send out messages in English because they didn't have their service providers didn't allow other languages, and they saw a very good response back in just the English language because most at least according to them, there was always somebody that could translate the message for them. But that was the response they gave to us.
Well, folks, we're at our hour right now. I found this session to be extraordinary, and I especially want to thank Julie, Stephen, and Adriana for being faculty to the session. You guys were fantastic, showing us what you're doing inside Northeast Valley, showing us what's going on inside Monterey, and my special gratitude goes out to Angela and all the work she's done in the landscape. And if you look in the chat, you'll see the link to the landscape on the CCI website. Are there any final closing questions? This has been absolutely amazing for me. Thank you very, very much, folks. I hope everybody has a wonderful weekend.
Okay, thank you, everyone.
Thank you.
Thank you.